Most people have no idea if their knee is actually ready after ACL surgery. And honestly, most physical therapists don't either. Research shows that over 55% of physical therapists use the wrong tests or don't even test at all before clearing their patients for activities like running and sports. And that's a huge reason why only around 60% of people get back to their pre-injury level and why 1 in every 5 people re-tear their ACL. In this video, I'm breaking down the critical tests that every ACL recovery needs at every stage, plus the key benchmarks that tell you if your knee is ready or not, because skipping them might be the reason why your knee still hurts and feels weak. Here's the thing, your ACL recovery shouldn't be based on time alone. Time matters, but time is just time. And just because it's been 3 months in surgery doesn't mean you're ready to run. Just because it's been 9 months in surgery doesn't mean you're ready to ski or play sports. Everyone recovers a bit differently, and time is only a small part of the equation. What actually matters is objective data, numbers, measurable proof that your knee is prepared for what you're asking it to do. Without testing, ACL recovery is like playing darts blindfolded and hoping to hit a bullseye. And here's the thing, hope is not a strategy. So let's get to exactly what tests matter most, from strength, swelling, range of motion, all the way to jumping performance and psychological readiness. So you can see how your knee truly stacks up and avoid being part of the re-injury statistics. First up is knee swelling. This should be one of the first assessments done in the early stages after surgery and then continuously monitored throughout your entire recovery journey. Now, swelling is completely normal in the early stages after injury and also after surgery, and it's actually necessary for proper healing to occur. Swelling gets a bad reputation, but the context is incredibly important. But here's the kicker. Swelling is one way that your knee can talk to you. So if swelling increases after physical therapy or activities, or if swelling is lingering longer than it should, this is your knee's way of saying that it isn't too happy with what you've been doing. Swelling needs to be gradually reducing over time, and this is why it's so important that it's being measured. So there's two simple ways to measure swelling appropriately. The first way is by doing a circumferential measurement, which can easily be done yourself at home. And the second way is through the sweep or the stroke test, which is typically performed by a medical professional. I actually made a full detailed video showing you exactly how to measure swelling, what the numbers mean, and how to best manage it, and also when swelling should be gone. Check out the video card up here in the right-hand corner, and I'll also drop the link in the video description. Restoring full knee range of motion that is symmetrical to your non-surgical knee is critical for improving quality of life, long-term joint health, and reducing re-injury risk. So you might be thinking, do those last few degrees of knee range of motion really matter? And I will be the first to tell you that yes, they do. And they often are the missing link that's causing knee issues and holding back people's recovery. But how do you know that you truly have full range of motion? You guessed it, it needs to be measured. So there's a few ways to measure knee range of motion. A device called a goniometer is probably the most common way, and it's used to measure joint angles by correctly aligning the axis of rotation of the device and the two arms along anatomical landmarks. An inclinometer can also be used in a similar fashion. There are specific inclinometer devices, but you could also use an app on your smartphone. Super, super easy. One of the ways I commonly use to measure range of motion progress with my online clients is by using an app. With the proper images, I can use the app to measure joint angles accurately. Visual assessments are another really useful way to monitor knee range of motion, but they need to be used in conjunction with the previously mentioned methods to get concrete numbers. With visual assessments, one angle doesn't always tell the whole story. So I like to use a combination of different camera angles and instructions to determine the root cause of my client's range of motion issues. We could have an active problem, a passive problem, or a combination of both. Not all range of motion issues are created the same. So finding the actual root cause tells me exactly what my clients need in order to improve it. If you want to learn exactly how to self-diagnose your range of motion issues at home, as well as come up with a specific game plan to address what you find, click the video card in the top right corner of this video, and I'll also put that link in the description for you. The third form of testing that everybody needs to be doing during their ACL recovery, regardless of their goals, is proper muscle strength testing, especially the quadriceps and also the hamstring muscles. Hip and calf muscle strength are also important, so I suggest assessing those as well. But the quad muscles take the biggest hit by far after the surgery, and they will directly impact how you feel, how you move, and your re-injury risk. At the end of your recovery, a strength goal should be to have at least 90% symmetry between your surgical leg and your non-surgical leg. This is called a limb symmetry index. This means if your non-surgical leg can produce 100 pounds of force, your surgical leg should be able to produce at least 90 pounds. The limb symmetry index is great, but it isn't a perfect measure and it does have its limitations. So using a knee torque to body weight ratio also provides extremely valuable information as well. Now, there are a few acceptable ways to measure proper muscle strength. But first, let's start out by identifying those that are not acceptable tests. Pushing your leg into your physical therapist or your surgeon's hands tells you nothing about quadriceps strength. This is called a manual muscle test. And the problem is your hand cannot accurately tell the difference between 60% strength, 70% strength, 80% strength, and therefore cannot accurately detect muscle strength deficits. This leads to poorly informed decision making. A single leg squat or a single leg step down test is not a quad strength test. This movement assessment is very useful for identifying movement compensations, motor strategies, and dynamic stability, which are all valuable, but it's not an acceptable way to test quad strength. Performing a repetition max test for a single leg press is not an acceptable form of a quadriceps strength test. Is this a useless test? I don't think so, but here's the issue. The leg press uses your quads, your glutes, and your hip adductor muscles to move the weight. Research shows that these hip muscles will compensate for a weak quad. So someone can have a nearly symmetrical leg press strength between legs, but they could still have a huge quadriceps strength deficit compared to their other leg. The leg press test can be used to look at overall leg strength, but it should never be used in isolation. So there's three acceptable methods to formally assess quadriceps and hamstring muscle strength. The gold standard is isokinetic dynamometry. This is performed on a big fancy machine where you're strapped in with a harness and you follow a standardized protocol and your force output is assessed. If you have access to this, I strongly advise that you use it. This machine will also give other forms of valuable information, such as rated force development, peak torque values, torque to body weight ratios, and many others. The second acceptable method is isometric dynamometry. This device can take a few forms and will either be a handheld device or a type of pull dynamometer. These devices are relatively inexpensive for PT clinics and they provide incredibly valuable information. They also have been shown to provide similar results when compared to isokinetic testing, making it a valid alternative. And lastly, performing a one repetition maximum test on a knee extension or a leg curl machine has also been shown to be pretty comparable to isokinetic testing when an appropriate standardized protocol is followed. Formal strength testing will typically start around 3 to 4 months after surgery, but this depends on a case by case basis. Your rehab program should be gradually building your knee up to tolerate a strength test. Yes, testing needs to be earned. This is a maximum effort test, right? Then if you've only been using light weights and you've never been truly challenged in your rehab, doing a strength test is like trying to run a marathon when you've only trained to run a mile. The gap is huge and your knee can get irritated from it. Formal strength testing typically should be repeated every 4 to 6 weeks so we can measure progress. If we never get actual numbers, it's like, how do you know where you're actually at? How do you know if you're actually getting stronger? And how do you know if you're truly hitting the numbers shown in the medical research needed to safely perform specific activities like running, jumping, and returning to sports? Without testing, you don't know. So before you start these activities, you need objective proof that your knee is strong enough. Otherwise, it's a complete guess and you're rolling the dice with your knee health. But even if your numbers look good on paper, there's still one piece that often gets missed, and it's a big one. Confidence is just as important as being physically ready. You can have a strong knee, but if you don't trust it, your body will find ways to compensate. It's like driving a fast car, but keeping your foot on the brakes the whole time. On the flip side, you can be overconfident, where you feel that you're ready to progress, where you want your knee to be ready, but physically, your knee isn't actually there yet. This is where a lot of people get into trouble. trying things, right? Trying things they want their knee to be ready for, not what their knee is actually ready for. And this is why using both physical and psychological testing is important. There are validated tools like the ACL RSI, the Tampa scale of kinesiophobia, the knee outcome scale, and others. The specific tool used will determine the passing score required. I recommend using more than one scale. Now, the rest of the testing I'm going to cover will depend on your end goals. Everyone should be getting their swelling, their range of motion, their strength, and psychological readiness formally measured. But not everyone needs these next three forms of testing. It really boils down to understanding the demands of the sport or the activity you're looking to get back into, and an ACL specialist will know exactly how to get you there and what testing needs to be done. So once you build that strength and laid the foundation, it's time to see how your knee performs dynamically. Jump testing is where we are measuring rate of force development, utilization of what we call the stretch shortening cycle, body control, and exposure to explosive movements. Jumping and plyometrics bridge the gap between foundational strength and athleticism. So it needs to be measured if you're looking to get back into sports and high impact activities. There's no one perfect jumping test. So a full battery of tests should be performed. This will include forward hopping, side hopping, rotational hopping, and forms of vertical hopping. Most tests will be performed on one leg and then compared to the other leg, as well as compared to normative data for people of similar age, sex, sport, and competitive level. But the numbers don't tell the whole story. How you jump and how you land are incredibly important. I've seen tons of people who have passing scores numerically, but they are compensating and landing poorly. So I always have my clients film their jumps from multiple angles to make sure that they are using appropriate movement and landing strategies. If you're looking to get back into pivoting and cutting sports like soccer, American football, and basketball, there needs to be a change of direction testing in your testing battery. It's one thing to be strong, but it's another thing to actually be able to express that strength quickly as your body changes direction. Video analysis here is absolutely critical. These tests will be performed at very high speeds, so filming and slowing things down will allow a trained professional to identify compensations. Not only are we looking for a performance criteria, such as how fast you can complete these cutting tests, right? But more importantly, we're looking for proper cutting mechanics to make sure that you aren't placing your knee at risk for future injury. Just like jumping, a max effort change of direction test at full speed should never be the first time you're doing cutting maneuvers. Some examples of change of direction tests are going to include the T test, the pro agility test, and cutting at multiple different angles. Your program should have included months of cutting preparation and change of direction programming to build you up to full speed. And hey, if you don't have sufficient strength, you have no business cutting. So now you can see why proper testing along this journey will determine when you are safe and ready for these activities. Last but not least, a forgotten metric is sports specific conditioning, cardiovascular fitness. How prepared is your gas tank compared to the demands of the sport you're trying to return to? Think about it. You likely haven't played your sport in over a year or even more, so making sure that your conditioning is up to par is super important. The type of test here really depends on your sport and position. So, for example, right, testing for a midfielder in soccer will look pretty different than an American football lineman. The midfielder requires a blend of endurance and short bursts of max effort speed. So a test like the 300-yard shuttle and 12-minute run test would be appropriate. For a lineman, tests like the 40-yard dash or even the 300-yard shuttle would be appropriate. The difference between hoping your knee is ready and knowing it's ready comes down to testing. If you're not being formally tested consistently across the areas discussed in this video, you're basically flying blind. The truth is, proper testing isn't just about safety, it's about confidence. It's about knowing that your knee can actually handle the demands of your lifestyle, not just easing into things with no direction. So if you're in that stage where things feel uncertain, maybe you've been told that you're cleared, but something just doesn't feel right, or you just want to make sure that you're on the right track, head to the link in the video description and book a free ACL strategy call with me. We'll break down where you're currently at, what tests you need, and what's holding you back. And if you found this video helpful, hit that like button, subscribe, and share it with someone who's on the same journey as you. Let's build your knee back stronger than ever.